Hi everyone, I'm Dr. Siti Kausar binti Zakaria. The topic of psychology that I want to discuss today is about abnormal psychology. Actually, abnormal psychology is a subfield of psychology which is examine psychopathology and aberrant behavior. Abnormal psychology frequently in the setting of clinical practice. The word of abnormal psychology encompasses a wide spectrum of diseases including depression, obsessive-compulsive disorder, and personality disorder. Psychologists like clinical psychologists, psychotherapists, and counselors frequently engage in the direct practice in this area. Okay, the definition of abnormal psychology is hotly contested. Who decided what constitutes normal behavior or abnormal behavior exactly? Okay, social norms that are frequently used to distinguish between what is normal and what is abnormal can change throughout the time. Therefore, it is difficult, very difficult to come up with a universal definition. Distress is caused by abnormal behavior. These behaviors may be distressing to the individual or upsetting and disruptive to others. A person's ability to function is hampered by abnormal behavior. People who exhibit this behavior may find it difficult to function normally in their daily lives, which can have an impact on their relationship, work, school, and home life. Social disruption is caused by abnormal behavior. It may violate social norms and makes people's ability to function in social setting and maintain social relationship very difficult. There are numerous perspectives of abnormal psychology. For example, from psychoanalytic approach, behavioral approach, and medical approach. Okay, let me explain one by one. Okay, abnormal psychology from a psychoanalytic approach has its roots in the theories of Sigmund Freud. The psychoanalytic approach suggests that many abnormal behaviors stem from unconscious thoughts, desires, and memories. Therapists who take this approach believe that by analyzing their memories, behaviors, thoughts, and even dreams, people can uncover and deal with some of these feelings that have been leading to the maladaptive behaviors and distress. Then, behavioral approach. Behavioral approach focuses on observable behaviors. In behavioral therapy, the focus on reinforcing positive behaviors and not reinforcing maladaptive behaviors. Abnormal psychology from cognitive approach focus on how internal thoughts, perception, and reasoning contribute to psychological disorder. Cognitive treatment typically focus on helping the individual change their thought or reaction. Cognitive therapy might also be used in conjunction with behavior method in a technique known as cognitive behavioral therapy, or called as CBT. Psychologists often look to abnormal behaviors through a number of different perspectives, including the psychoanalytic behavior, cognitive, and medical approaches. Such perspective can influence how a condition is treated, but therapists also often draw on techniques from multiple approaches. Okay, thank you very much for watching. That's all for today. Bye.